All right, welcome everybody. My name is Megan Renee Parker, and I'm the current president of the Puget Sound chapter of NATS. Hello, and we are so beyond thrilled and excited to have with us today Dr. David Meyer joining us from the East Coast. Hello! For a presentation and discussion on several different topics. We've got kind of 5 topics here if you're going to count on your digits. That's right. Put your hands up. We've got 5 topics. Woohoo! Centered around long COVID. Oh yeah, we can get a woo woo for 10. Centered around long COVID, performance anxiety, and trauma awareness. And I want to introduce Dr. Meyer to you. So here's a little bit about our main presenter today. So about David, he is a leading scholar and researcher of the singing voice. Baritone David Meyer is an active performer, teacher, clinician, and voice scientist. He serves as Associate Professor of Voice and Voice Pedagogy at Shenandoah Conservatory and is Director of the Janette Voice Research Center. Hopefully I'm pronouncing that correctly. He's also a member of the Scientific Advisory Board of the Voice Foundation and is co-chairman of the Voice Science Advisory Committee of the National Association of Teachers of Singing. In 2010, he received the Van L. Lawrence Fellowship, a prestigious national award in recognition of his contributions to the field of teaching singing and the use of voice science. Dr. Meyer's students have won numerous awards and have sung in major venues worldwide. And I'm told, hot off the presses, as of like 13 minutes ago, he is now the new associate editor of the Journal of Singing. Yay, and a proud cat owner. So let's welcome David Meyer. Yay!
Oh, thank you for that, Megan. So the Journal of Singing, John Nix and I are co-associate editing a new column about how to take science and make it applicable. So it's a collaboration between the two of us, and it was brought about by Lynn Helding. I've got a ton. Yeah, we're really excited about it, and the board was meeting right as at the beginning of this. So I'm pleased. Can you all see my screen all right? Nice, pretty Shenandoah. So this is me. I'm going to first go and get rid of my Zoom floating control so that I don't have that taking up some of my real estate. Good. All right. So I came up with this title rather late and didn't get out on the website, but this is Understanding the Effects of Long COVID, Stress, and MPA, Music Performance Anxiety on Singers. And I've got a couple of important disclosures here. So first of all, the information in this presentation is 100% true and worthy of full acceptance and universally applicable to everybody, except when it's wrong or not helpful. So this isn't the be-all, end-all of all of these topics. There's a lot of ground we're covering, and there's a lot of slides. Some things will be covered a little bit too superficially. I don't like that, but you'll have the slides, you'll have the recording later. So hopefully this can be a jumping off point for some of your own learning. And like Megan said, we're going to start at the thumb and talk about long COVID, a study that we just published. And then we're going to talk about some of the psychological costs of the pandemic. That'll be your index finger. And those studies are around a year old, which in today's day and age, that's kind of old. So your index finger needs a grain of salt. Singers and stress is number 3. And then trauma awareness and supporting singers and what we can take from the world of education to help our singers is number 4. That's your ring finger. And then by the time we get to the pinky, this might be too silly of an analogy, but I'm going to go with it if you don't mind. By the time we get to your pinky, we're going to talk about some MPA, music performance anxiety research that Dr. Katie DeFilio did here at Shenandoah and some additional resources. So the number 1, your thumb. This is the study on singing voice symptomatology following COVID infection. And this was the result of a big team. We had 3 of my master's students, and then we had 2 epidemiologists and me. We consulted with some other folks as well. Now, how many of us were affected by the pandemic? A whole lot. If the USA population is 331 million people, we had reported cases of 103 million. That's reported, and talking with my girlfriend. She's like, when I had COVID, I don't think I was counted because she took an at-home test. She knew she was sick. She stayed home until she got better. So 103 million cases in the States is certainly on the low side, right? And we had just over a million deaths from it. But what this means is that at a minimum, 1 in 3 people here contracted COVID. I've not yet, knock on wood, but in my social circle, it makes me a little unusual. Of those who contracted COVID, at least 1 in 7 seems to have developed long COVID. So this is terribly common. And for this thumb section of my talk, this yellow box down here is the link to this article. And you'll have all these slides from Puget Sound Nats as well. So globally, we have at least 94 million people who have had long COVID, and singers are uniquely affected. So to try and learn more about this, we sent out a survey. We had 23 questions on the survey. We talked about demographics and singing and singer health and what symptoms they had. We also had 2 short answer questions that were really helpful. And this survey we put out there in English and then translated into Spanish, Portuguese, and then both traditional and simplified Mandarin Chinese. We sent out individual emails to invite people to participate. We sent out around 6,000 individually addressed emails. This is what student labor and a lot of time in the evening after the workday is done, paste the name in, send it out to someone. Did you all receive some of these invites? I hope you did. The team for this study, like I said, we had an epidemiologist, the head of infectious diseases at the University of Iowa. We had a psychometrician and a biostatistician. We had an otolaryngologist, Dr. Tom Carroll, over at Harvard, and then faculty and students at my place, the Janette Voice Research Center. And we wanted to learn about singers' perspectives. We wanted to cover a lot of demographic groups, and we wanted to have multicultural sensitivity. And so we had respondents from every continent in the world, except for Antarctica. It's very hard to find respondents from Antarctica in most of these studies. And we only had 2 from Africa, but we reached every other continent. I wish we had more from Asia because there were many folks in China that we invited through our contacts. But to respond to this survey, even to say that you had COVID, presented more of a risk for our Chinese colleagues. They didn't feel comfortable in taking part in an anonymous survey dealing with COVID because it's very sensitive in their country. And a number of our respondents didn't say what continent they were from. We learned after the fact that a number of folks in Mexico, for example, or in Central America, didn't feel comfortable choosing North or South America. We were using continental descriptors, and they felt left out by that. You always learn what you don't know as you do a study. There's things that you're unaware of when you go into it. That was one. So we had 1,153 respondents. A handful of them we had to discard. If they're under 18, we discarded them. If they say they didn't have COVID, I don't know why they were taking the survey, but we discarded 102 of them. And if they had COVID but didn't have a positive test, we discarded them as well, because we wanted to really be sure that these were folks who were singers, who were not minors, who had confirmed diagnoses. We wanted to learn exactly what was going on with this population. So we have pretty stringent inclusion criteria. Of the 1,100 folks that took this survey, and of those that were then able to be included, 60% of them, just over 60%, reported having long COVID, according to CDC guidelines. That's a really shocking figure, right? But it doesn't mean that 60% of folks getting COVID are going to have long COVID. This represented what we call a sampling bias. People with long COVID were more motivated to participate in this survey than someone who had a very mild case, for example. So it represented a huge figure, but it doesn't mean 60% of those who get COVID are going to have long COVID. And interestingly, this is a finding that I wanted to make sure and highlight. People who reported having a runny nose or nasal congestion when they were first infected seemed to have less of a change to their singing voice. Isn't that interesting? It's not so intuitive, but the Omicron variant and later variants tended to bind to the tissues in the nasal passageways better than the original variants, than COVID classic, right? And so the original variants of COVID were typically infecting people more deeply in the lungs, and then you had the pulmonary or the lung sequelae that were much more serious, and people died a lot from those. So if you had Omicron or later, you tended to have a higher infection in your respiratory tract, which is good because it affects your singing less. We had no idea that that would be the case. But the big main finding is those who had severe disease were typically those who had worse experiences with long COVID and worse experiences with their singing voice. So if you reported cough, sore throat, and shortness of breath, those were associated very clearly with a reported change in singing voice, and that could last for many months on. And likewise, 4 weeks after, if you had this lingering, then it also very strongly related to your change in your singing. The main issues that were reported were dyspnea, which is problems with your breathing, and dysphonia, which is problems with your vocal folds, like laryngitis. Laryngopharyngeal symptoms happened occasionally, and other otolaryngologic symptoms and signs. But typically, we had a lot of folks report a change in tone or vocal fatigue, reduced range. These were common. And again, the article is right here, so please do go and take a look at it. It will be on my website soon. I have to update some of my publications. Breathing concerns, breath support for the singers was a big problem, and general problems with breathing. Shortness of breath or depth of breath also occurred frequently. But in general, and I'm sorry this is so very superficial, but since we have so many things today, you should know as teachers that the amount of time we can ask our singers to practice or to rehearse or to perform, for many of them, their ability to sing for an extended period of time has been reduced. And if they had severe infection, they're over 5 times more likely to experience a negative change in their singing voice compared to people with mild infection. The most commonly reported things that are going to be affecting our singers are general fatigue, and chronic fatigue is one of the real hallmarks of long COVID. Chronic fatigue is exacerbated by emotional, extreme emotional moments. If you're performing and you're trying to give an emotional performance, that can trigger chronic fatigue, as can stress. And young people tend to have a harder time with chronic fatigue as well. Changes the breath management and brain fog. Brain fog. The study had some limitations, and no study is perfect, but we're pretty proud of this one. It took a big team, and we worked really hard on it. So my question for you, this is right at the end of the thumb, at the end of part 1, is what strategies are you all using to address some of these changes that you see in your students, if any? If you guys want to unmute and say something, that'd be just fine. Are you seeing any of these changes?
I don't know that I've seen anyone specifically in my studio with long COVID, but it's been a good check-in to, and I have done this with students with other vocal injury, shortening their lessons to doing just a half an hour, say, instead of a full hour-long session. And
Do you ever do multiple half an hours in a week? I used
yeah.
to really dislike that, but I'm coming around to the idea of we'll work technique on this one, and we'll work the voice on repertoire on another half hour. Makes scheduling a pain, doesn't it?
Easier with online students, but yes, splitting an hour into 2,
Oh,
I've
indeed.
definitely done that before. Yes, and David, it sounds like you had your hand raised. I think you're still on mute.
Now you can hear me?
Yeah.
Mm-hmm.
Yeah, I feel really lucky that I haven't had any nobody that has had COVID. Everybody has had COVID. I am the only person I know that hasn't had COVID. But I have a student who has really bad asthma, and she noticed, that after that she had a lot less breath control. It got better. it wasn't even a bad case of COVID, and it was like in the past year. But I did have a student who caught COVID around the turn of the century, not turn of the and between 2019 and 2020, and was somewhere, I don't know exactly where he was, but somewhere in the heartland, singing an opera, and the conductor came in from Italy, and he had a bacterial infection, and everybody got sick, and nobody knew that it was COVID. So it was pretty horrific, and it was all a bunch of young, healthy people, and they were sick. Everybody was sick for about a week, and then they all got better and did the opera. So, I guess I've been really, really lucky but yeah, but my one student is the one that who has asthma, and she was so afraid of getting it and then got it. So, yeah. I have a really quick question, David. What is a psychometrician?
So when you have a survey study, there's ways of designing a survey study that can make your information you're trying to gather mean more or mean less. And for example, have you stopped beating your dog? It's a stupid example, I know, but the way you ask a question can skew. Sorry for the stupid example, but
it elicits the kind of answer you either want or don't want.
Yeah, and it also helps us to reduce our own bias, because we work a lot with research at my school, and our students are oftentimes going into studies by saying, I do this thing and this thing is amazing, now I want to prove that this thing works. And that's not how the scientific method really works. We have a hunch, but then we go out and try and prove our hunch wrong. And when we can't prove our hunch wrong, then we're left with an important result. Okay. And the psychometrician helps you design studies that don't have
the core of it without.
Yeah. They help you avoid stupid mistakes that just because you don't live in this world all the time, it's easy to make dumb mistakes. If you try and do a study all by yourself, you don't know what you don't know. And you end up making bad mistakes that make the study, it's not honoring the time that your participants are putting in. When you have over 1,000 people giving time to you, you want to do it right and honor that gift.
Yeah. That's all I had. I was just, what is that?
Should we go on to the index finger? Oh, Holly, go.
I was just going to quickly add, I've got a few students who exhibit what you described with the fatigue and the sort of building back stamina. But I've also had 3 students in my studio, and they're older women. I think they range from in their late 40s to in their almost 70. And all 3 of these women have what I think is a neurological thing, where we had to completely readdress registration with all of them.
Sure.
Because something changed. It didn't feel right, and it was not controllable in the same way that they were used to before. And they're all primarily choral singers. And it's just been really fascinating because they were so similar.
Yeah.
And having never seen this sort of a thing in my studio before, I've assumed it's a neurological thing from post-COVID, because they all had it and it all appeared after. And we're just kind of going back to basics.
And I wish we could study that, but that's nearly impossible. So there's this thing called viral neuropathy, and that's where the virus actually damages the nerves that control your vocal mechanism. You've got these cranial nerves coming out right by your jugular and carotid, and then a branch of them goes off to feed most of your laryngeal muscles, and another branch goes off to feed just the cricothyroid. And those nerves, they're about half the size of a strand of spaghetti, like angel hair pasta. There you go. And those guys can get attacked by viruses, not just COVID, but other viruses too. And viral neuropathy is what freaks me out. And I try not to walk on eggshells with my voice. I try not to be super crazy careful, because I can't live that way. But I'm motivated not to get COVID because of long COVID. And also viral neuropathy can change the way your brain communicates with your instrument in ways that you have to, like you said, you have to retool it, because those pathways aren't the same anymore. There's not as much as the same signal getting through. Yeah. So I should have said a lot of this talk is a little bit of a downer, and I really don't mean to be a Debbie Downer kind of character here, but knowledge is power, and I think this will help us help our students. Should we move on to the index finger then? That was the thumb.
Is this thumbs up if I do this? Thumbs up? We're all gonna go, okay.
Cool. So here's part 2, the psychological costs. And let me do that same thing of getting rid of the floating meeting controls real quick. Cool. So the index finger part of this talk has studies that are around a year old, but they still have something to tell us, even though they're a bit old. Q et al. Did this study with over 52,000 participants in China, and they developed this tool, the COVID-19 Paratraumatic Distress Index, the CPDI, and they administered this tool to ask about people's mental health during and after the pandemic, and a third of folks had experienced psychological distress. And of those 52, almost 53,000 people, who did it hit the worst? Typically, it was folks 18 to 30 years of age or above 60. Typically, it was female identifying people, and typically it was highly educated people. These aren't singers. These are just regular, ordinary people. And young people, they said because of young people's exposure to social media, some of this paratraumatic distress was worse. It was more easily triggered because of their reliance on social media. This index that they developed has been used all over the world. It's been used in at least 36 studies. And it's interesting that many of the studies done in Iran, done in Italy, done in the East Asia, they found that women had a harder time, generally speaking. And in general, this goes back to 2013, our female identifying students are going to, statistically speaking, be more likely to have post-traumatic distress from whatever trauma they've experienced. Not everyone, of course, but statistically speaking, they're slightly more at risk than other populations. So this is a study done in France, and they showed that, again, about a third of the folks in this study of 1,000 people experienced psychological distress. And this acute paratraumatic distress from the pandemic was a strong predictor of poor mental health outcomes 3 to 4 months later. And about 1 out of 7 developed clinical cases of this distress after the lockdowns were lifted. All right, yet another study looking at this distress, 43% had high levels of depression. This is with almost 1,000 participants. 45%, so 400 people, give or take, had high levels of PTSD, had high levels of anxiety, and a third had PTSD. This is worth paying attention to because young adults had a really hard time during the pandemic, and some of those mental health costs, I believe we're still paying. Horesh and Brown, they had this interesting take. They suggested that this pandemic and the time after it was something like a new type of mass trauma. We have traumas from earthquakes and from natural disasters and war that have been afflicting humanity for a long time, but this type of pandemic was something relatively novel, and it stressed us. I think we all understand that. It exacerbated underlying mental health problems in our society, and it caused new stress-related disorders for a number of people. It's like they said, it's like an ongoing cardiac stress test on the world's infrastructures and systems, and it magnifies things that in ways where we were just barely getting by and just holding on, we weren't doing great, but then we have this pandemic hit, and the cracks are busted apart in certain cases. So the psychological costs, this is the index finger part, and I gave you a bunch of studies all at once, but the general gist of it is we and our students have lived through some hard things. That's a very obvious statement. Um, the mental health the mental health costs to the pandemic are borne especially strongly by folks who are female identifying and younger and highly educated. And that is a large percentage of who we teach. So if you consider, and my clock is loud. So bear in mind that our mental health costs have changed certain parts of what we need to address as teachers. PTSD is not going to be a rare thing. Anxiety and depression are relatively common. So that's the index finger. And I know that was a little bit quick. Partly that's because those studies are less current than some of the other ones. Are there any questions before I jump right into part 3?
For me, I'm mulling over a connection between anxiety and fatigue, what you mentioned from the first portion. And if you have any thoughts or ideas on the relationship between the two, it sounds to me like it might be something that's a little bit of a self-perpetuating
Oh,
circle.
for sure.
Yeah.
For some people, absolutely, because chronic fatigue is triggered or exacerbated by moments of emotional exertion. And so if you have anxiety for a certain situation and then you're in that situation, for example, juries, if the preparation up until juries is very stressful and then you go in and sing the jury, that could absolutely trigger chronic fatigue where someone might need to stay in bed for a few days following something like that. And me being the mean, grumpy white guy voice teacher, I could say, well, come on, you have to, if I don't know what I know, I could address students experiencing chronic fatigue in ways that are inappropriate. Oh, you just need to buckle down and get your act together. That would be an inappropriate response on my part. I might use that response with my 14-year-old, but I'm working on it. And the next part, so the middle finger part talks about singers in stress, which dovetails nicely into this paratraumatic distress and what we know about the long COVID. Is it all right, folks? If anything before I just jump into that?
We might discontinue
Angie?
using the finger to give our signal for the next one and just maybe give a thumbs up instead of the middle finger this time. Okay? Yeah, let's do that if we're moving on to the middle finger version.
It's the Northwest, so however you roll is fine by me. Okay, cool.
The point finger. Okay. Thanks, Dr. Meyer.
All right, just a quick second. I should. Hide meaning floating controls. Good. All right. So singers in stress. Singers in general, pandemic notwithstanding, so this is transitioning away from the COVID part of the talk. Singers in general have unique psychological risk factors. For many of us, it's very difficult to separate who we are from what we do. I am a singer. I mean, singing is my vocation, or singing is my profession, or singing is my hobby, but I am a singer is the common way of saying it, right? And performers, they have an especially difficult time when there's a problem with the voice. It's very difficult to separate yourself from your instrument. I remember I sang a competition in Pennsylvania when I was in grad school. And I got up there, and a couple of the judges were people I knew from master classes and worked with them. And I got out there and I sang a high note badly. And I was so angry with myself for the rest of the day as we drove back to Indiana. And my pianist said, well, it's not you, it's your voice. And he was being really smart in that moment. He was helping me to separate my instrument and my use of it from who I was as a person. I'm still the same friend or the same son or the same father. But singers, we're connected to our instrument. You know that. And stress in general is a big deal in our culture. 50 to 70% of physician visits prior to the pandemic, this is 1989, this study, 50 to 70% of doctor visits were due to stress-induced illness. And then we have this endocrinologist, Hans Selye. He's the one who popularized the term stress, the term that we don't think about twice now. But he studied stress in the 1930s, and he induced stress in animals to study their response. I wouldn't want to be an animal in that study. But he found three phases to their response. The first one was alarm, this fight or flight response. And then the second phase was adaptation, where they got used to, they responded and adapted to that stress. But then the third phase was exhaustion, and this sometimes led to the death of the animals that he was studying. And I find it really interesting to think of that, especially coming out of the pandemic. We had alarm, and then we adapted. We used masks, we used Zoom, we used different modalities, but then people just simply got to be really tired. And so our response to stress is worth thinking about. Long-term stress is really bad for the body. It can cause muscle tension and a reduced ability to concentrate, insomnia, chronic fatigue, asthma, which we were talking about earlier. And it can cause immunosuppression and increased gastric acid secretion. This is an important thing to think about with ulcers, but also with reflux laryngitis. So with gastroesophageal reflux, or worse yet, with LPR, laryngopharyngeal reflux, when we are secreting more acid, then we may be more likely, especially with stress, to then reflux that acid more frequently and higher up into our throat, which can then also trigger asthma. So reflux at night can absolutely be one of the main triggers in causing asthma. So like you were saying, Megan, these things can absolutely be cyclic and feed on themselves, and stress generally can even lead to a heart attack. Anxiety changes how we use our voice. And I think we've all experienced when we've been singing and we've been under stress and we find our voice starts to do different things. For me, the main symptom has always been my breath support gets weird because my breathing musculature sometimes will lock up. But stress and anxiety can lead to a greater prevalence of vocal fold lesions like nodules, cysts, polyps, etc. But we can have voice symptoms that don't have an underlying physical pathology, which is to say, you could look at the vocal folds, they could look nice and perfect and beautiful and pink, and there could still be a problem. A laryngoscope exam that looks perfect doesn't mean that there isn't a problem with the mechanism, unfortunately. And the laryngeal nerve, it's sensitive to stress. We were talking about viral neuropathy earlier, but stress in general can also trigger that nerve, like we're triggered by smoke. If we're a non-smoker and our throat goes into a little bit of laryngospasm, stress can also do that for us. Just think of when you're about trying not to cry, what your speaking voice does, and you have a little bit of laryngospasm. And this is one of the big take-home things in our middle finger part of the talk. Technical difficulties can often be the result of deeply rooted emotional issues. So we might be thinking, my student is having a technical problem, when it actually could be caused by something that's emotional or psychological. And we need to be aware of that. And the stress that we've had coming out of this pandemic, a lot of singers have lost careers or lost their sense of self. Interpersonal connections and empathy with other people has taken a big hit as well. Many of us have even had family members and friends and colleagues pass away in the last 2-3 years. And trauma in the literature is linked to these social phobias, to music performance anxiety, which is our pinky finger on this talk tonight, and depression and grief. Depression, anxiety, music performance anxiety, and grief, these are things that should be on our radar screen when we're working with students, because sometimes they're affecting our students' ability to learn and to progress in their voices. And major depression is also something that I didn't know this before I was researching for this in a previous talk. 1 out of 7 of us, so if we have 7 of us on the screen, at least 1 of us has suffered a bout with major depression. And we don't talk about it as if it's as normal and common an occurrence as that, but it is. The definition of a major depressive episode is 5 of these 9 symptoms that lasts 2 or more weeks. And I think it's probably a greater prevalence than 17%. And being able to talk about this and in a normalized manner, I think would do our students a great service. Fred Rogers used to say, if we can mention it, we can manage it. And I absolutely love that thought, because sometimes these issues, we're not their psychologists, we're not their therapists, absolutely. But I will 100% feel comfortable referring my student to the counseling center because I've received help from mental health practitioners in the past, and I know that these are things that we can talk about. That's the end of the middle finger portion. Oops, I hit end show. I'll pull it back up. Do you have any questions about that part? Is it too much of a downer for a Sunday night?
David, I'd love to hear what you have to say about how we as voice teachers might approach students who are in the midst of some of this mental health struggle, especially because of the pandemic, when we have to get stuff done in the studio and it can't be a therapy session, but we want to be sensitive to what they're going through. And, you know, I know a colleague of mine who's a trumpet professor had a talk with all of his students at the beginning of the school year this year and said, look, I know we're all suffering from the pandemic. We all have some things that we're working through, blah, 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 but we're not going to talk about it in our studio. And he was really like, we're not going to do this anymore. And I thought, oh, I never thought about doing something like that. I'd just be curious to hear if anybody has thoughts on how to sort of set those boundaries in your studio, but also acknowledge that you see that your student is having these struggles, et cetera, et cetera. I don't have good language for that.
Yeah, and if anyone has one cookie cutter approach for everyone, I'll probably put on my contrary doubter hat. That's a great question, Holly. We got good on the screen. What do you all think?
Sorry. I took a class. I took 2 classes actually. Hold on one second. Hold on, I got background music. I took a class. It's called Mental Health First Aiders, and it's through the state of Washington. And you get a certificate. It's a 2-day class that you have. And I took it for that reason because I had so many students come in with some issues I didn't feel obviously qualified to handle, and I wanted to be able to help them some way. So it trains you what resources are available. So if you do recognize someone having some issues, you can recognize that they are, and then have resources that you can suggest and how to suggest things to them. You're just kind of a liaison between, that knowing that you got something wrong, but not knowing what to do about it. You were that person to help them through that. I mean, I've had some serious problem. I've had a student come in the day after she found her friend who had killed himself with a shotgun. I mean, what do you say to that child, So that was a lot of things. So I took that class. I suggest everyone who deals with kids or teaches in that capacity to take those courses. They're free too, and be able to identify and help suggest where to go for that. That's all.
Thanks, Kathleen. I'd love to get that link from you so we can include it with the materials from today.
Okay. Let me do my thing here.
Davida, did you have your hand up?
I just wanted to say I want that information. That's it. That's great. But I didn't want to interrupt.
Well, Holly has this way of introducing the next part of the talk, and we didn't even powwow about this ahead of time. But is it okay if I jump into the ring finger? So 4 or 5. All right. 1 quick second. Good. So part 4 is trauma awareness. And what can we do in our studios? I think learning about trauma-aware pedagogy is a reasonable thing to do. And I love this illustration. This is coming out of the airline industry saying, make sure if you need the oxygen masks, make sure to put on your own mask before helping someone else. So as singing teachers, make sure to prioritize your own wellness so that you have more to be giving to your students. And I am working on getting better about this myself. But trauma-informed pedagogy in general considers how trauma affects our learners and their behavior. And it can absolutely slow down or limit their ability to learn things. You can have the most gifted student and you can be the most gifted teacher, but that one piece of the puzzle can inhibit their progress in your voice studio. And those students who've experienced trauma, and these aren't rare occurrences, they're the ones who are more likely to fall behind or get in trouble for behavioral issues. And we know a lot about trauma awareness from the world of education. My good friend Jess Baldwin wrote this article from Singing in Popular Musics, and she says these 10 things, and this will be the one slide I read at you. I hate it when people read slides, so I hope you don't mind, but prioritizing your own self-regulation, taking care of yourself, prioritizing your own wellness is important. Having a plan and communicating it to the student. What are you hoping to accomplish in that lesson? What are they bringing in that they want to accomplish? What are they responsible for in the week following this lesson? And these asterisks are pointing you towards an article that Lynn Helding and I wrote a year and a half ago, 2 years ago, in the Journal of Singing. And here's the PDF of it is on the NATS website as well. But this article talks a lot about how science can help, without any technology, can help you build connection with your students. And that's a big deal. A connection ritual, when they first walk in, what are the first 30 seconds of your lesson like? I imagine most of you say, how are you doing? How's your voice this week? Has it been a good week? How is your practicing? Choosing connection over productivity. And this goes exactly to Holly's comment. The connection with the student so that they know that you were there to help them with their voice is going to be more predictive of how well they do than how many pieces they get memorized for juries. And me, I'm a product kind of person, and I need to be mindful of that. Validating their feelings. This is something I think about daily with my 14-year-old because he has big feelings. Cutting things into smaller bites. If they have a recital coming up, it can feel overwhelming. But if they know every day I need to work on this half of this piece, and I need to work on the text, or I need to work on the memorization or the analysis, you give them very discrete small bites, then the huge overwhelming thing feels much less scary. Showing appreciation for effort. This is emphasizing the importance of the process, what we're doing daily versus the product, how well they did on their jury. Product matters, but the process is where we can influence them, and that's where the growth happens. And yeah, fun, calm connection. And I like to say that we never know exactly what someone else is going through. I've had, in the last month and a half, I've had about 5 different big conflicts, not through my singing studio, thankfully, but big conflicts with, I'm on faculty senate, and so we work our way through conflict. And I try to sit back and think, when someone's behaving in a way that is really annoying or really difficult, I try to remind myself that I don't know what's going on with them. So the behavior can be absolutely annoying, but I try to suspend my judgment because I don't know what's going on. And sometimes we all know that we go through stuff that other people don't know about. So yeah, Davida. There, I think you're on mute.
So sorry, I keep forgetting. Can you go back to the page? There were a couple things that you skipped over.
I skipped over 8 and 9 because I hate it when people read slides to me, and I thought
no, don't hate it. Don't
right,
hater.
Don't hate on reading. Okay, good. So number 8 was focusing on positive resources. So what can you do when you're experiencing trouble? What are some positive things that you can do? And Jessica's article goes into depth on all of this. The URL is right here, which is too long, but you'll get these slides.
Okay, that's still I don't understand, but that's okay. I'll read the article. And yeah, because they're just like not clear to me, and I'm going to shut up.
She knows more about this than me, to be honest, but I want to point you to it because I found this useful. Is that good, Davida? Cool.
No, I'm sorry. I keep, and be aware of the student's self-regulation. I don't know. I don't understand what that means either.
Sometimes people are doing the best they can, even when, from my point of view, it's not good enough. And I need to be aware that sometimes I can't ask of them
Okay.
the level of control over their reactions to their emotions, the level of energy to give to the work. Sometimes I want to ask of them levels of commitment or work or control over big emotions that I might be asking them something that's unreasonable if I'm not aware that they could be doing the best they are able to do in that moment.
Is that something akin to asking somebody to do something, which is like you ask everybody to do it and they refuse, like, and it triggers them,
Sure.
and then
And
you
those
can't.
triggers, absolutely. And those triggers sometimes this comes out of sexual abuse too. And this, I reread this article in preparation for tonight. According to Breer and Scott, 25 to 35% of our female students, statistically speaking, have been victims of sexual abuse, which is absolutely unacceptable and abhorrent. But we need to be aware of that. And 10 to 20% of the men as well. And these students, you ask them to look in a mirror to check their posture. Well, triggering can absolutely happen for these students by looking in the mirror. And God forbid you're the dingbat teacher who from 40 years ago who thinks it's okay to put your hands all over the students. I have a real problem with teachers that are handsy, because I think in this day and age there's no excuse for that. Mirror use is something that a number of students are going to have problems with. Body armoring is something I didn't know about before rereading this article too. And psychological protective strategies. You can lock up your breathing muscles as a way of protecting yourself from some of those harms. And in one case in this study, vocal identity even was a trigger for this student. They were resisting singing soprano in Dr. Johnson's article here. This came out of her dissertation work back about 14 years ago. She was resisting singing soprano because that felt weaker to her. And so she wanted to be a mezzo. I mean, mezzos are great. We all know that. But she wanted to be a mezzo because it felt more protected and less strong, less weak than being a soprano. And I had a student who would break down into tears when she would sing in head register. And in our first few lessons, we got halfway through and she was crying as we started to explore the top of the voice. After talking about it, it became clear that she shared that she had some relationship difficulties with her mother, who was a soprano. And so when she would start singing like that, it would bring back the memories of that conflict with her mom. And being able to talk about that just at that level then allowed her to move past it. I'm not her therapist, but she was able to say, this is, I think, why I'm having that difficulty. And then once you externalize it and say it, it made it less overwhelming, if that makes sense. And lastly, number 6 ties in really nicely with what Davida was just saying. How many of us have gone to workshops where a teacher is leading a student through some sort of relaxation technique? You lay on the floor and you focus on breathing, or you focus on tensing and then releasing certain muscles. But according to this study, that can absolutely trigger really violent responses or horrible responses for people who have been through sexual abuse. So being aware of those things, I think, is going to be a useful thing for us as teachers. And so McQuiston wrote this article more recently, but I think I like the Johnson article even better. These are other sources that I won't spend time on tonight, but there's a fair amount of good research on how we can help our singers who are coming to us with real lives, oftentimes having lived through hard things. How can we be aware of that in our pedagogy? And the world of education is great for this. So take a picture of this slide with your phones, or look at the slides when I share them. But the world of education has spent a lot of time on this because they're far further ahead than we are. All of these sources are really useful in just getting an idea of what's happening in the world of trauma aware pedagogy. This Facebook group is very active as well, and I've learned a lot through them. My girlfriend teaches English as a second language to fifth graders, and many of her students are immigrants. And when she has them doing drawing exercises, drawing a story so that they can talk about it, these are kids that are talking about their parents being taken away by the cartel, or these are parents who have had border crossing trauma. Many of our students in the schools, and many of our students, statistically speaking, maybe maybe a fifth to a quarter of our students will have had some sort of sexual trauma too, statistically speaking. So it makes a lot of sense to do some reading outside of just the voice pedagogy literature about how we can be aware of what some of these students go through and make sure that we're not doing anything to make it worse. The Hippocratic Oath of doing no harm, I don't think goes far enough in this case. I think the harm has been done to these students already, whether it's sexual abuse or other types of trauma. Goodness, that student who witnessed or found their friend who had committed suicide, or trauma coming out of the pandemic, which is about a third of the students as well. The harm has already been done, so doing no more harm, I think, is our responsibility as teachers. Are there any questions about that? That's part 4.
I think for me, I'm just soaking in, especially the comment on process over productivity. I know that can be a challenge, but I've certainly had several instances where conversation with a student will completely change the trajectory of our work, and how important that is, to get to some really meaningful work. That's the productivity, is the meaningful work.
But that speaks to your sensitivity and letting the student be an equal partner in where is the lesson going to go on that day, rather than this is what I, as the teacher, am going to dictate that we accomplish. That speaks to a nice sensitivity on your part, Megan.
Well, I bring it up because I feel guilty. It didn't happen sooner, to be honest, but sometimes when you run into those roadblocks of, gosh, my bag of tricks is just not showing results. It's not showing up for this student. You never know. Yeah. I don't know if any of you have experiences like that or have thoughts on some different related topics here. I see head nods. Mm-hmm.
Can I chime in a second? Julie Rosenzweig, speech pathologist, not singing teacher. Sorry to spy on you guys. I will say that I feel like, although what Dr. Meyer said about productivity and then forming this relationship with the patient, I do find that sometimes when people are unsupported in their trauma in a way that's more appropriate than me as a speech pathologist, it can hijack not just that session, and I use the word hijack, oopsie, not just that session, but every single session. And I don't want to, what I tell the patient is, I can empathize with them, I can hear what they're saying, I can hear how difficult it is. I can also tell them that I'm not the person who's going to be able to help them in this realm, and that I want them to take advantage of what I do have to offer. I just feel like things can just go way off track if I try to get too deep into helping them with things that I'm not at all qualified to deal with.
And scope of practice is such an important thing to consider too. When we have laryngology and speech language pathology and psychology colleagues, we know how far the boundary of our scope of practice goes. And we have this voice community, hopefully all of you have an SLP like Julie or someone in your own area that you can call when they have a phonological problem or a voice problem or a speech problem. Hopefully you have a laryngologist that you can call that your singers can go get some stroboscopy from someone who knows about the mechanism more than at just a cursory level, but knows about what the singing voice requires of it. And when you have that community, you know things that they don't, and vice versa. But it's your clients will always have better outcomes when you have that team approach, especially with these folks who have been through things like this. Does that jive with what you experienced, Julie?
Absolutely. And I'm also advocating for making sure that part of that team, in the case of the type of trauma response that we're talking about, is more of a psychological / counseling approach, or whatever type of therapeutic approach is beneficial for these patients. Just for me to know scope of practice, exactly like you said, but to also include the mental health piece from someone who's better at it, and to encourage the patient to, or student in your case, to go and seek that. And oftentimes, okay, not oftentimes, all right, 3 times in the last 22 years. So a few times I have actually told somebody that I hear what they're going through, and maybe it would be better for them to seek that care first and then come back to me, and I'll be here.
That makes perfect sense too. Okay, that was part 4 of 5, but let's go on to the pinky finger. This is the last part. Oh, my strange hand counting. I asked my boy today, it's like, how do you count? When you count to 5, and he's like, yeah, start with a thumb. So I feel confident about that. All right. Dun, dun, dun. Sorry, just a quick moment. Good and good. All right, so finally, I wanted to show you some research on music performance anxiety that my doctoral student, Dr. Katie DeFilio, did, and also present a few resources at the end. There are people who write entire books on MPA. This isn't the exhaustive talk on music performance anxiety, but I want you to be aware of one thing that, especially that we found out with Katie's study. Katie's study was a psychophysiological study. That might be the longest term that you hear in this whole talk, but that's taking the psychological and the physiological. So what is the software that our brain is sending out to the body? And the physiological is the function of these structures, and psychophysiological combines both of them. We wanted to collect the physiological measures of the body and also the psychological measures of their state anxiety. And we did this with an ambulatory device, sort of like a Fitbit watch, and hopefully this will help impact future studies. And had 7 participants, which is quite a low end, but good for a first attempt. And these were people who were singers who experienced music performance anxiety. And importantly, they were in good general health, and they weren't taking beta blockers, which would then change the heart rate and then change the data for the physiological measures. This is the Empatica device that they wore, and measured heart rate and electrodermal activity. EDA is a measure of how conductive your skin is. So when you sweat, your body's response to stress or to activation is sweat. That makes your skin more conductive because of the electricity has an easier time going across the sweaty skin. So the heart rate and how sweaty your skin was were measured by the wristwatch. And then there were 2 self-report state anxiety data tools that we used. And we put them through these 3 conditions. So one was you go into a practice room and you practice your song, and we'll measure your singing. We did baseline measures before these as well, but go into the practice room and sing your song. And then the second condition was a rehearsal, which was more like a lesson. You were rehearsing with your pianist with your voice teacher present. And we thought that number 1 would be the least stressful. Number 2 would be sort of a medium stressor. And then number 3 was a public performance. It was actually a jury performance. We thought that would be the most stressful condition. And what we found is that the heart rate scores, these colored lines are the different participants, and the dashed line is the average or the mean. The heart rate didn't correlate all that well from these different conditions. And the electrodermal activity showed something really interesting. So in the rehearsal where their teacher was present, they showed a physiological response to stress, much more than for most people than when they were in a public performance. And their STAIS scores showed increased levels of stress in the rehearsal with their teacher present compared to the practice room or even a public jury. The Likert scale for their anxiety rating tended to go with what we would assume would be the case, more stress in performance than in rehearsal. It's not exactly what their bodies said, though. The big takeaway from Dr. DeFilio's study, and right down here's a URL where you can download her dissertation if you want to read about this in more detail, is that these participants experienced higher measures of stress, partly during self-report and partly with electrodermal activity, when they were singing in front of their teacher than even when they were singing a jury. So what does that tell us? Well, you can have a wonderful relationship with your student, and they are still sometimes very stressed about doing well in their lesson. And being aware that they might be having more performance anxiety in the lesson than they do even in a public performance. That's an important bit of knowledge to have in your toolbox. Additionally, if you don't own this book, you ought to go out and buy Lynn Helding's book, The Musician's Mind, because in her chapter 6, she does a beautiful job of summarizing the most important music performance anxiety work that I've found in layman's terms. So she takes it and digests it and translates it beautifully in her chapter 6. She looks at the different psychotherapies and alternative therapies and experimental therapies. She mentioned Don Green's approach, and here's the citation vertically on the screen if that's not too annoying to read. Don Green basically has a conditioning technique for his students who are experiencing music performance anxiety. So those students who are really nervous performers, he will have them go up and down a flight of stairs a few times in order to simulate stress. It's a safe sort of conditioning technique. They are simulating being out of breath and raised heart rate and feeling a little bit of stress and a little bit of arousal physically. And then he'll have them sing. And when you do that a few times, you get them conditioned to the idea that I can still sing when my body is experiencing these effects. And I find that really interesting. Elevated heart rate, slightly reduced levels of oxygen, sweaty hands, even tight abdominal muscles. How do you sing when your body is responding that way? I find that a really interesting approach. Anyway, buy Lynn's book. And the take-home message in part 5. I wanted to say a quick word about the Therapeutic Alliance. So in psychotherapy, they've had a number of different meta-studies where they try to analyze which techniques might be most helpful for which people. And they try to correlate, is Jungian or talk therapy, cognitive behavioral therapy, are one of these therapeutic approaches more effective than others? And what they really found that correlated was the Therapeutic Alliance, which is to say, if you are in a therapy session and you believe that your therapist can help you, and the therapist is doing things to indicate that they care about your progress and that they can help you, that working relationship was more predictive of how well people did in therapy than any other single measure. And I think what that can tell us as voice teachers, not that we are going to be therapists, by no means. However, the connection we have with our student might be more important in certain cases than knowing factoids. And I'm a big science geeky person, if that's not clear by now. Very often, my pedagogy students want to say the right thing, but it's usually much more important how we teach them than necessarily what we teach. The what matters, but the how matters more, if that makes any sense. And many of us have experienced loss during these last 3 years. And people who have experienced trauma or are working their way through anxiety, depression, and grief, these seem to be common sequelae of our students coming into the studio these days. But absolutely, when in doubt, refer out. I'm hoping that you all have mental health and medical professionals and therapeutic professionals that you can refer your students to frequently, because we don't want to be their therapists, of course. And there are a lot of resources that you can avail yourself of to learn more about trauma awareness in the voice studio. The world of education has done excellent work with this because they need to. So many of our students have experienced these traumatic issues. And I like to quote Epictetus. So this is the oldest thing that you'll ever see in one of my talks. But Epictetus was this Greek philosopher. He was an enslaved person, in fact, in the 2nd century. And he said that it's not what happens to you, but how you react to it. That's where you have your power, and that's what really matters. And when something happens, you have this power of how you choose to react to it. And I find that so helpful. Our students will have many things thrown at them, but they have a lot of agency and a lot of power that they don't necessarily feel in the moment. They can react to it in ways that they choose. But that's also the oldest source that I'll ever cite. And the last slide is I want just to send a shout out to all of our colleagues, because they are one of our greatest professional and pedagogical resources. These relationships, interdisciplinary and between colleagues, is one of our greatest strengths. And none of us are alone in any of this, though some days it may feel it. That's what I've got. This is my website down here, David Meyer Voice, and I've got a lot of talks and papers and student dissertations and some singing things there. And that's my boy when he was a little bit smaller than he is today. And just for the sake of the recording, I'm going to scroll through a couple of pages of these sources, and there are more than just these. This was the talk of many sources. And that's what I have, ladies and gentlemen. So let me get my meeting
I
controls
encourage
up.
us to use all 10 digits to give Dr. Meyer a round of applause.
Oh, thank you.
Yay! Then I'm going to go like
Fantastic.
this because I feel like I'm still drinking from the fire hose a little bit of all of the topics we covered today, which I know was a lot. So I want to be sure to toss it back to any thoughts and or questions that you all might have as you let this kind of start to settle in. I hear a laugh. I think that might have been DeVito.
Davita's going to save us from the quiet Zoom screen, I think.
Well, I would just like to say that was a very, very in-depth and informative and really great presentation. So congratulations. Kudos, David.
Oh, thank you.
Absolutely. And I definitely feel like I'm going to be keeping an eye out while staying in my lane, of course, for these issues that we're seeing across studios. I especially found it fascinating, the idea that a student's most triggering place of anxiety might be in our studios. I did have a teen student, who took 2 lessons for them to even vocalize for me coming out of the pandemic. They were so afraid to vocalize in a one-on-one scenario. Did theater classes with their peers, no problem, but that one-on-one scenario was really difficult. So I think we're all seeing it out there.
So what did you do that was helpful with her?
Took some time, just validated feelings and said, that's okay. If you're not feeling up to it today, we can try again another time. Or, even just talking about in general her and what she likes to do when she's singing at her theater classes. And the second session, she felt up to it. But I had to restructure the lesson. Normally, I might do a couple vocal exercises, and we got to singing her piece, and by that time she was able to maybe work through a couple different ideas, but it was not the normal format of what I might consider a normal lesson. Mm-hmm.
But you being willing to give up what is normal and what your conceptions of the lesson are, that's another. I think Megan's doing some good things. Suzanne asked a question.
To have a student who just like could not even vocalize, felt very, very scary to the student.
And then you sit in your studio and you're thinking, what in the heck am I going to do to be helpful in this moment?
Yeah.
Yeah, we all know that feeling. Suzanne had a question in the chat about having a student who had a similar concern with head voice, as it was triggering some trauma with her mom relationship as well. And hopefully the student is also receiving some counseling from someone outside, in the mental health field. Occasionally, you can do things with straws and semi-occluded vocal exercises where you work that part of the voice, but it doesn't sound like real singing. And so it helps them sort of separate from those feelings of judgment or perhaps the connection to that trauma. I had to be okay with my student who had that issue is a wonderful performer and doing really well now. But I had to be okay with, well, she sang for half of the lesson and then the emotions came and she just needed to be able to be done at half the lesson without any judgment. She just needed to be okay saying, I think that's the work that I can do today, and not getting any grief from me over it. What helps you, Suzanne? That's annoying to answer a question with a question, but that I'm curious.
Yeah, I'm fighting a cold right now, so can't talk very well. But at first she could not even go there to that part of her voice. And we've just been working really steadily. And over time, she's starting to do that. But I think validating the emotions, the trauma, I think that, and she does have counseling support as well, which is great. So, an additional support there. But I think it's just taken time and patience. But I've seen a lot of progress. It's really exciting. But yeah, I love what you said about, maybe sounds that aren't quite singing.
Do you ever do speech to singing exercises where you're just getting her to phonate in that modality, in that way, and it's not singing, so there's less judgment?
Yeah. Do you have any specific ones that you recommend for that, or?
Lots of people do sirens. That sounds like kind of a basic one. I like SOVTEs because, especially with the tiny coffee stirrer straws, because they sound so weird, they feel so weird, but they do such good things for the voice. Yeah, I will often have people also, because our perception of voice is so tightly linked to our production of voice, the way we hear it influences the way we make it. I'll sometimes have them put their hands like this and then sing in a way. So some people do it where they want more feedback, but I will also do it like this so they hear more of the reflected sound in the room. And for a lot of my singers that are really judgy or wanting to control, that listening to the sound as if it's reflecting off the walls in the room helps them take a step back from that monitoring and put the voice on autopilot. Straw saved the day. Yep. Says Katie. Renee Fleming came and talked to us at PAVA a couple of years ago in North Carolina. And she said, the first thing she said was, straws changed my life. This was about 6 or 7 years ago. And I taught the straws since about 2005. And after Renee said that, I was like, okay, everyone's getting exposed to this. It feels weird. It sounds weird. But most people find a way of getting a benefit from it. And they're almost never going to hurt themselves. And it helps take a step back from that hyper monitoring, hyper judging of their own sound.
David, I have a question. It was your doctoral student.
Hello, Kari. I
Hi,
haven't seen
David.
you in a couple of years.
I know, little thing called COVID, huh? Your doctoral student research was on collegiate students that measured that. So I'd be really curious what those measurements were with emerging and professional singers after the academic setting and even the high school age. I'm really curious about the academic setting and the teacher and how that would influence that study or different.
Sure. There's about 15 different dissertations waiting to be done based on what Katie learned, but it was really mind-blowing to think that students, many of them were experiencing more physiological signs of stress in the lesson with teachers that they liked, but they were so much wanting to do well, they were so much wanting to not screw up, please the teacher, and that stress could perhaps be a barrier to their progress if we're not smart teachers anyway. Yeah, absolutely. What about the people singing at the Met? What are their body responses to anxiety? I don't know anybody who doesn't experience some arousal or anxiety when they perform at any levels. I was just talking with Larry Brownlee the other day, one of the greatest tenors alive right now, and he feels it. Just like my 17-year-old about to audition for a college student feels it. And I think the 17-year-old hearing that even the great singers feel this physical arousal when they get up in front of people, their heart rate gets pumping and their breathing starts to change. That's a part of what we do. Hearing that is often helpful for them because then they don't feel like we all have a tendency to think that we suck so bad, we're so horrible, everyone is better than us. At least a lot of us feel that way. And to know that we're all on the same boat with our body's response. Listen, when you stand up in front of a group of strangers with nothing between you and them and you just look at them, 1,000 years ago, that was a death sentence. If you're in front of a group that's not your tribe and you're surrounded by these people you don't know, our bodies are hardwired to think that's a dangerous situation. So it makes sense that we pay a certain cost in performing. But performing is also an awesome thing. So, yep, Tom Burke has, yep. Davida?
Oh, just a quick little thing. I think that people want to get rid of all anxiety, or they want to get rid of all that adrenaline. It's scary, it's whatever. It is necessary. You cannot perform without it. I experienced something in Germany. I was singing a role that I absolutely hated. I was bored. It drove me crazy, and I had to do jumping jacks backstage before my entrance to get my heart rate up. I was just like, can't believe I have to do this again.
And lots of these students will get stressed that they are feeling stressed too. I should be relaxed. Why am I not relaxed?
Yeah, you need the adrenaline, or it doesn't work.
I tell my students when I'm relaxed, I'm on the sofa with a 20-pound cat on me watching Netflix and my boys on my feet. But if I felt like that when I'm performing, I might be in real trouble. Sorry, Kathleen, I didn't mean to cut you off.
Oh no, I like the story of your cat. No, anxiety lives in the fight of the feelings. Everyone has anxiety. Everyone feels the body sensations. Those that try to fight those sensations, that's where anxiety lives. And you just feed the fire, you fuel the fire if you fight those feelings. It helps to say to a student or someone with anxiety like me to accept and allow this. Just go ahead, just surrender, go spaghetti. That's my latest terms, go spaghetti. and go ahead. And I tell you, the anxiety can just dissipate. I also tell my students that it's not about them, it's about the music. So it's not about them. It's you're there to just tell the story and make beautiful music.
I think there's a big difference between anxiety and adrenaline. Yes. And I think that when people feel adrenaline, it freaks them out.
It's the same.
And that's why what you were saying, David, about, the study where like you'll have somebody run up and down the stairs to get their heart rate up to, it's like you don't feel freaked out when you do that. So why does when your heart's, it's not, don't label it as anxiety. It's just adrenaline.
It's the same physical sensations.
Yeah, and it's your friend. It's not something to be fought or try to, fight.
And for my students, just the act of naming things can be very powerful.
Mhm.
Yeah.
And I know when I was going through a really hard time professionally, some years back, and I was feeling a powerful feeling, being able to step back and say, I am feeling this. And knowing that those feelings pass, my 14-year-old isn't home right now. Otherwise he'd be running in saying, stop talking about me. Because I preach this at him all the time. But when I'm feeling this feeling, I know that feeling isn't going to be around. It's going to pass. But the act of name has been very helpful for a lot of my students as well. Because that gives you a certain power over it.
Yes. Wonderful. Well, thank you everyone for your comments. I want to give a quick shout out to a couple things that came through the chat for the recording. Angie said Tom Burke with regard to the registration idea of how to access maybe some different registration in a way that's not tied to singing. Tom Burke has a series of great animal sounds. I'm going to check that out. I think that would be fun for all ages. And then a great comment by Dr. Reagan on a recent NATS chat that she did with Marco Guzman on water bubbles. There's a link in the chat, and I can be sure to include that link in the materials for everyone as well. Research very interesting and thought-provoking. So thanks to Dr. Reagan for sharing that as well. We've got a whole full meal deal. I was joking with David before we started the talk today that we could have called this the smorgasbord talk or something. We've got like
kitchen sink talk,
potluck of just everything. But in our brains, it made sense that everything kind of tied back together as we began this journey with COVID and are continuing this journey with our students.
And shout out to Holly for like continually jumping us ahead to the next topic so nicely.
Right, so it had a trajectory. Hopefully, Holly was following it with the rest of us. Yes, I want to be sure and give a shout out for some other amazing educational events that we have coming up. We have a wonderful opportunity here in the Seattle area to take part in the Art and Science of the Performing Voice. And I want to give a quick mic toss to Dr. Kari Reagan to tell us a little bit more about that and opportunity we'll have to take part coming up in May.
I'll do it very quickly. Thank you, Megan, since it's a non-NATS event, but it's here in Seattle. And this is our 8th year. It's a very, very special multidisciplinary conference that the committee members are at the UW-Laryngology program, of which Julie Rosenzweig is on, my partner in crime there, Dr. Murati, myself, Marty Navdal. And I put in the chat northwestvoice.org early bird registration. We keep the price very low. It's $95. A 2-day conference of this magnitude, access to the MDs and the SLPs and voice teachers would be much more expensive. So we really try and keep it low. It is multidisciplinary, but we make it application oriented. And this year I have, let's see if that will post. So Carrie Obert is coming this year. She will be doing 3 sessions for us: finding your voice and exploration of pharyngeal shapes, reframing our ideas around tension, practical application in the clinic and studio, and strategies to address vibrato and vocal tremor in clinic and studio. And then Trinice Robinson Martin will be giving a masterclass and also a presentation on let's see if I can send that as well. On Black American music voice pedagogy, what teachers and clinicians should know. So, and lots of others. The whole program's up on the website now, May 12th and 13th. And anyway, I will be asking if you have singers that want to sing in the masterclass, Black American folk oriented music with Trinice. So anyway, I hope to see a lot of you there. Take advantage of this great conference.
You guys know that Trinice is wonderful, right?
She is wonderful.
Cool.
Yeah. As is Carrie Obert. Carrie Obert, who is both deep in research and SLP in clinic and a voice teacher. So she offers a lot of knowledge. Thank you, Megan, for letting me.
Thank you,
Do it.
Dr. Reagan. And thank you to Dr. Meyer again for all of your hard work in providing just such a wonderful resource for us to come back to. I'm so looking forward to sharing this with all the folks who had conflicts and couldn't attend today as an ongoing educational resource, and why NATS is on the cutting edge of all things voice science and cool things.
And thanks to Megan for putting all of these things together and offering our Puget Sound friends such a wealth of opportunities too. Well done.
Hey, it all began with a board meeting, and somebody said, "What about long COVID?" And Holly said, "What about Dr. David Meyer?" And here we are today. So I love how these connections with our fellow teachers just really lead to cool opportunities. So yay! Thank you, everyone. Without further ado, we'll give another round of applause to all of you, and I'm going to hit stop record. So thank you, everyone.
Be well, David.